Hey, I'm Dr. James St.Clair, and I am super grateful to be able to present to you today a couple of slides and thoughts that I have around the topic of do no harm. We ended up naming this How to Fine Tune Your Pet's Rehab. So canine rehabilitation started back in the late 80s and early 90s, and it really has become one of the pillars or foundations now in the animal health space. And so I just want to kind of give everybody a little introduction to that world, and then just some of my thoughts around how you can, as a pet parent, play an active role. So again, my name is Dr. James St.Clair. I've been practicing for 20 years. I spent 10 years in canine rehabilitation, started in 2004 in that space. And for 15 years, I've been in the world of supplemental nutrition and creating products to help pets like yours. So let's get in. So we're going to just cover the current world of rehabilitation. And then I want to get into why you, the parents, are such playing such an instrumental role in your pet's animal health experience. And I want to teach you some of the things that I think you could look out for. We're going to talk about how to fine tune, have the mindset of fine tuning your pet's wellness over their lifetime. And then I just want to cover a couple thoughts on why living an anti-inflammatory lifestyle is important to your pet as well as yours, and just a couple of my favorite supplements that we have. So, as I said, canine rehab started in the late 80s and then the late 80s, early 90s. And so what's important to know is that there is actually certifications, and there are credentialed humans that are out there providing these services. So right now in the United States, we have 3 programs. There's the University of Tennessee program. There's the Canine Rehab Institute program, which comes out of Colorado. And then there is a new program called Prima Certification. Also, what I don't have on this slide, and I wanted to just mention, is that in the veterinary space, there is the American College of Board Certified Sports Medicine and Rehab Doctors. So currently there's 154 of these diplomats or advanced trained veterinarians who are focused on canine physical therapy, rehabilitation, sports medicine. So there's a lot of, it's a growing field, and they have a lot of value to add to pet parents, at least in the United States, and I know heavily in Europe. So, canine rehab. There's currently probably about 500 plus facilities across the United States. Our company has a directory. That was the current number that I calculated out of our directory of all the rehab facilities that are across the country. So there's a lot of them. If you just go in and search canine rehab your state, you'll find a list there. And what's good to know is that in these facilities, a lot of these doctors are not only certified in canine rehab, but a lot of them have also branched out and got advanced training in acupuncture or chiropractics. And I think that diversity of modalities available under one roof can be a huge value add. So look, physical therapy, whether it's in people or in animals, has the same core principles. And so the basics of physical therapy are going to be around these particular modalities. Now, you got hot and cold therapy. So as you know, your dog has an acute injury, you should be icing for 72 hours. Post that period, we either use a variation of hot and cold mixed therapy or just moist heat therapy. You also have massage, stretching, trigger point therapy. And then these practitioners will also, when you go to see them, start to make a kind of a plan for which therapeutic exercises in both strengthening or proprioception, that's balance, that they can start to take in based on the therapy plan that they decide on. And then a lot of them will teach you what you can do at home. They'll use electric stimulation, super common in human physical therapy, and therapeutic ultrasound. So, and then in the canine rehab world, it is unique because though hydrotherapy and water therapy is available in human physical therapy, you find it much more commonly used in canine physical therapy. As you see on the image on the left there, there's a dog that is in an underwater treadmill. I'm sure a lot of people have seen what this image looks like. Based on the level of the water and the therapist being in the pool, it really helps to reduce the weight on the dog, especially if they have, had post-operative surgery, and that's why they're going for physical therapy, or they're an older arthritic dog and they need, the water level higher to give them some buoyancy while they start to work on and exercise those targeted muscles. We also have low level laser therapy, which the physical therapists have high powered lasers. Though they're low level laser, they're still high powered lasers than what you could purchase on the market. But that is such an incredible therapy, tons of research behind it. There's also pulse signal therapy and shock wave therapy, a little less commonly used, but still have tremendous potential benefits. And then there is just the home option. So in our company at TopDog, we really were focused on how do we play an active role in educating the pet parents themselves so that you could play an active role at home doing therapy with your dog at an at-home level. So these certified canine rehab practitioners could help guide you in creating a fitness plan or some kind of therapy plan that you could work at home. I wanted to bring up this new device. It came out a couple of years ago. We did a clinical study inside of our hospital on this low-level light therapy that is used for at-home use. And I just put down that 8 of the 10 participants after the study wanted to have one in their own home because of the benefits that they saw from using this kind of therapy, even at home. And then, of course, it's just nailing down diet and nutrition. You have to have the mentality that food is medicine, and we'll get more into that. So, why are pet parents the key? Look, there is a challenge in veterinary medicine on the Western side of things where we live a bit inside of a reactive mindset. We are trained as doctors to identify disease and then create the plan or the management of that disease. But it's really backwards at the end of the day. This really needs to be a far more proactive approach. And that's where you guys come in, because your eyes, seeing them on a daily basis at home is so critical for when you come and are able to communicate with us about what you're seeing at home. So I really want to kind of get into that and empower you, the parent, because by far, probably the most important element is you. So have a proactive mindset. What I wanted to relay, I hope through this series that Your Natural Dog put on, bringing on all these incredible experts to share their knowledge base, to empower you, that you had a paper and pencil out and you were taking good notes. And that as you were going through, you were actively trying to relate how this impacts your own pet's life. And then I just mentioned that the quality of life is really the focus that you need to have. Really honing down on what your pet's current quality of life is, whether you're at that point where you maybe missed something and we need to be a little bit more reactive at first and then kind of get into a proactive mindset, or you're just a really great pet parent and you want to get on the front end and you already have that proactive mindset and you're looking for to learn different solutions that are out there that could potentially help your animal in the future. So look, the veterinary community itself is still learning this too. They call it practice for a reason. We're experts in the sense that we're up to date on current and past treatments and modalities, but we're still learning. I wrote down here, even the veterinary community at one time thought that dogs and cats who were in pain would vocalize it. And we've clearly learned that that is not truthful. At TopDog, we refer to the silent signs of pain a lot, and we'll kind of run through those. But now when we're looking at pain interpretation, we're taking into account a lot of different factors. For example, we count the energy level, the heart rate, respiration, appetite, facial grimacing, ear positioning, whether they're back or forward, body positioning. We'll also even use just body temperature, sleeping patterns, any kind of recent weight loss and trending of weight loss, poor coat quality. The coat can tell a tremendous amount of things about what's going on farther deeper inside of the body. Any kind of like disconnect from you or their environment or other animals in their house. Sometimes they'll start to detach and act a little bit differently. And then there's the physical, that we'll talk about, which is essentially is just having a keen eye and being able to, recognize if there's any muscle atrophy or obvious lameness. So the patients that typically are going to benefit from the physical therapy canine rehab world are going to obviously be any of those animals that have post-orthopedic or neurosurgery. So as you know, the most common orthopedic injury in dogs is going to be an ACL tear. And then probably just having underlying hip dysplasia would be the second. Obviously, there's dogs that have intervertebral disc disease or had back injuries that would benefit from it. The dog that is an older arthritic dog is a big candidate for who could benefit from this. Chronic or acute neurologic conditions, and then obesity management. This is a big one. Some of these dogs really do benefit, especially in the hydrotherapy environments. They will benefit from the resistance that water provides, at the same time providing buoyancy and taking some of the stress off of those affected joints while they're building that muscle mass to support that joint. And then, of course, the canine athletes in the conditioning. So let's get into how we recognize pain, and a trained pet parent's eye is always going to provide better results at the end of the day. So at TopDog, we refer to these as the silent signs of pain, and we kind of broken them down into subcategories. So first, we're going to just talk about behavioral changes. So a dog that is shaking or trembling, you might notice that one of their hind limbs might be quivering when they walk and then come to a stop. So that would be a behavior change. You're going to have changes in sleep patterns. So some dogs that are in pain, they can't seem to, one, get themselves into the position of a relaxed sleeping position. So they'll get up, they'll readjust themselves, and then laid back down again. Obviously, changes in any kind of eating or drinking patterns. I use this one very frequently, whether the dog is starting to either avoid their traditional food that they were getting, or they were not eating as in the morning and just waiting until the afternoon. And then obviously aggressive behaviors. So if you don't feel good, some people that don't feel good can be pretty nasty. And the same with our buddies, our pets. So they don't feel well. It might not be who they are, but they're acting out because they're uncomfortable. Excessive grooming, joint licking. The dogs that have wrist problems or carpal problems, oftentimes you'll see them pacifying and licking that joint. Yawning is a big one. That's a commonly known sign of stress. So if you notice your pet yawns after they go to lay down, that could be a sign that that didn't really feel so good. I'm a little uncomfortable. Again, facial grimacing. And then ear positioning. I'm going to add just one more to this that I use on a daily basis, but there is a communication that they do often give with submission. So in an exam room, if I, for example, if a dog has an arthritic hip and I'm putting that dog into extension on that hip, the dog will oftentimes it'll do a little tongue licking behavior, which is telling me, I didn't really like how that felt. Please don't do it again. So those are just a short little list of behavioral changes. And then obviously there's the mobility changes. So just the simple fact of slowing down, we assume that this is just a normal part of aging. That is not true. It's usually tied to some kind of underlying pain point or challenge that they're having. Slow to get up, slow to go down. You can kind of see them delay or think about it, avoiding stairs or slow to go upstairs. There's the cartoon on the right there. The dog sits at the bottom of the stairs, looks up, and it's like, I'm going to do this. I can get up those stairs. We're going. So there's this delay, avoiding jumping into the car or the bed or the couch, sleeping more, sleeping longer. This is a big one for me. The older dogs who are in chronic arthritic pain will sleep more because it's uncomfortable when they're up and moving around. So that's a really good, easy one. Reluctance to go on walks or walking less. So sometimes they'll start quitting, right? It's like, I used to walk around the block. Now I only make it halfway around the block. And then there's more subtle things. There is the closed hind leg stance. So dogs who have either knees that are bothering them or hips that are bothering them, you'll see the dog walk. And then when they stop, those legs will come closer together and they'll kind of balance themselves as more. It's like one hind leg. For the dogs that eventually have elbow problems, or front leg problems, they'll go with a wider front leg stance. Bunny hopping, the dogs that their hips do not feel good or their knees do not feel good. For example, when they go up the stairs, they'll bunny hop their way up as opposed to ambulating their way up. Obviously, blatant limping and stiffness. So, and then there's the visual changes where you have muscle loss over time. You got to remember that this is a muscle skeletal system. It's a muscle skeletal system. The more muscle I have on my body, the more that muscle is supporting my skeletal system. And so we want a lot of muscle if possible. Visual changes in respiration, panting. I use this one a tremendous amount. And then, of course, the 5 symptoms of an inflammatory response. If you notice any kind of swelling, pain, redness, heat, and then immobility. So this is a really important concept that I want to relay, and I call it the power of the pain trial. And I said in talking to you all that this is really potentially useful, especially if you're working with a Western doctor, because again, the Western doctor is a far more reactive mindset, and they're going to be more comfortable with the certain medications or drugs that are used in the Western world to treat pain, such as nonsteroidal anti-inflammatories or certain pain medications like gabapentin. So the reason why I use this, though, is that it could provide a baseline. So if I used to have where I would ask my clients, do you think your dog is in pain? And they would say no. And then 9 out of 10 would say no. And I'd say, well, why? And they'd say, because the dog is not vocalizing. But at the end of the day, I'd prove to them that the dog is in pain. And I would do that by running a really short controlled pain trial with a nonsteroidal anti-inflammatory and or using gabapentin and tramadol, but it would be for only a 7-day period of time. And then we'd have a discussion afterwards. And then based on that result, it would allow us to then have a discussion about all of the natural options that can provide very similar results, but be far less harmful to that pet in the long term. So what I wanted to just relay in this, when we do a pain trial, we're not looking for some like mind-blowing change. All of a sudden, they're running around like a puppy again. What we're really looking for is the subtle improvement and transition of energy where they feel better. At the end of the day, they're more engaged. They want to be more active. And you can tell that there's this shoulder, this weight that's been lifted off of their shoulders. So just an important thing to think about, the power of a pain trial. And potentially, if you think it fits into your dog's situation, you can always talk to any of your doctors about that. So, and then the last concept around this is just really the mindset, the paradigm, the lens that you need to have as the pet parent, where we're focused on quality of life, not as in like in veterinary medicine, we refer to quality of life when we're having these conversations, as in it's like the end of life conversation, way late. Like quality of life is about every day and about fine tuning that over time. And so I wrote here that the root of most chronic pain is the progression of a degenerative disease that worsens over time. So we need to be conscientious that what we're doing today might not be the thing that's going to work in a month or work as well in 2 months or 6 months or a year, and that fine tuning, adding new elements, whether that's a new supplement or it's a new therapy modality, committing to that, and then having a keen eye on how that affects the quality of life. So I wrote test, 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 observe, observe, observe. So, and then of course, as we mentioned, just discussing the power of a natural anti-inflammatory lifestyle. Again, chronic inflammation, the root of all evil. Chronic inflammation, the root of most chronic health problems in dogs, such as arthritis, lots of cancer, allergies, autoimmune diseases, diabetes, inflammatory bowel disease, chronic pancreatitis, obviously based on the nutrition that that animal is getting. So the best outcomes are always going to start with a solid foundation of living a natural anti-inflammatory lifestyle. So proactive management starts with the basics, right? We have to choose the best nutrition, whole foods, raw-based nutrition. Low processed carbohydrates are always going to win all day long. I know that the Western world is just slowly starting to come into it and see the work out of the University of Helsinki and raw-based nutrition, but there's enough proof and data there that this is definitely the path. Keeping your dog in a really lean body weight is immensely critical. On so many levels, you have to learn what are the elements of what a lean body looks like. We think that we know. There's plenty of resources out there for you to figure out whether your dog is in ideal body weight or not. If they aren't, work with your doctor to make that path and get there. And then, of course, uncovering any genetic or breed predispositions. This is a huge passion of mine right now. And I think there's so many elements on how this is going to change the game, but something as simple as leveraging the Embark trial or DNA test that allows you to unlock, the 210 different genetic predispositions that they're currently scanning for, but even to understand your breed of dog or your mixed breed of dog, and then the genetic predispositions that are underneath that. I'm going to use a quick example, if I have time. King Charles Cavaliers, tremendous amount of heart disease in that breed. We have this tendency to wait until they start to show their signs of heart disease, as opposed to nutritionally supporting that organ system from the get-go in their life. Just a different lens that we need to be using and looking for with a proactive mindset. And then supplemental nutrition with proven anti-inflammatories. So just want to cover some of my favorites. We have a couple companies that are highly vested in the nutritional space. We do a lot of work with organic sulfur and MSM. We're actively out there doing a trial currently on MSM, 30 dogs in a real trial. It's going to be amazing to get those results. So I'm a huge fan of MSM. This raw material is a very powerful anti-inflammatory. It's an antioxidant. You'll find it in a number of joint products out there, but as a standalone raw material, this is such a great solution for large breed dogs and people that have multiple households. It's incredibly affordable, incredibly safe. And then hugely passionate about the world of omega-3 fatty acids, in particular, the green lip mussel. Not only is it incredible that this is such a biosustainable source of omega fatty acids, but it's the uniqueness of its fatty acid profile that really makes it special, and its richness in that omega fatty acid that we know is icosapentaenoic acid. So that's just a couple of things that I think are foundational elements of anti-inflammatory lifestyles, and thought we would share those with you. So I hope you found that informative, and look forward to connecting with all of you sometime in the near future. See ya.